Since I've had the Gynacare TVT treatment, I'm back to doing things that I haven't done in several years.
Well, I can cough, I can laugh, I can sneeze, and I don't have to worry about the leakage.
It's really nothing to be ashamed of. The main thing is that you go and get treatment for it, that you can enjoy life and do things that you've always wanted to.
Gynacare TVT, tension-free support for incontinence. An innovative treatment for stress urinary incontinence from Gynacare, a division of Ethicon, a Johnson & Johnson company. Just as Kathy, Pazetta, and Charmaine decided not to accept limitations on their daily lives, more and more women are seeking surgical treatment for stress urinary incontinence, also called SUI. The condition is a disorder of the urethra, the tube by which urine exits the bladder. In women with SUI, the urethra is unable to maintain a tight seal during sudden movements. As a result, women will involuntarily leak urine when they cough, laugh, sneeze, or exercise.
I'm a high school math teacher. Right now I teach geometry and trigonometry.
I was self-employed for 28 years. I did everything. I had a tavern and a restaurant.
I worked at the supermarket, and the doctor thought that from the lifting that I had done there, because I had done a lot of lifting, that maybe it came from that.
SUI affects women of all ages. Contributors to the condition include childbirth, menopause, estrogen deficiency, or pelvic surgery.
I probably have lived with this for, I would guess, about 5 years before I did anything about it.
I was about 32 or 33 years old when this problem started, and I didn't have the surgery until I was 57.
I was about 36 when I went to the doctors, and this is when he had gave me the pills and the Keel exercise. And I did them faithfully, but they did not, seem to work.
My dog had a leakage problem and they gave her a pill. It stopped, but I kind of thought that maybe I could get a pill too, that would help my condition.
I like to go to the islands and go to Hawaii and different places. And believe me, making sure that I packed my pads before I packed anything else for fear of going somewhere and leaving them home, then my vacation would have been ruined.
I think what really just made me decide that I needed to speak to a doctor about this was last summer when I would go out to play golf. Every time I swung the club, I would leak. I had learned to compensate in many other ways and step differently, but there was no way I was changing my golf swing, and it was just something I enjoyed doing too much.
When I was in my 60s, then I decided, well, something had to be done.
Finding the right treatment for me came 30-some years after I developed this problem.
Increasingly, doctors are selecting Gynacare TVT, tension-free support, as a preferred surgical option for stress urinary incontinence. Many patients prefer this approach because the surgery can be performed under local anesthesia. It is less invasive than most other surgical options, and the patient may go home the same day.
The doctor told me that with the Gynacare TVT treatment, I would go in the morning. They would just use local anesthesia, and that I could possibly go home that same day and really, start with my daily activities the next day.
More than 150,000 women worldwide have had surgery utilizing Gynacare TVT, tension-free support. Clinical studies show that 5 years after treatment, nearly 85% of women remain dry, and an additional 10% still experience a significant improvement in their condition.
I had this Gynacare TVT treatment, and it was very successful. In fact, 2 weeks after I had the operation, I went to Germany for 18 days, and I did not have one accident, and I felt wonderful.
Here's how Gynacare TVT, tension-free support, works. Your surgeon will insert a sling of mesh tape through a small incision in the vagina and place it beneath the urethra. Then your surgeon will pull the tape up through 2 small abdominal incisions just above the pubic area in the skin surface. To evaluate the positioning of the tape, your surgeon will ask you to cough. At the end of the procedure, your surgeon will cut the tape just under the skin surface and close the 2 small incisions with adhesive bandages. After the surgery, the tape will support the urethra during a sudden movement, such as a cough or laugh. You can expect a 2 to 3 week recovery period after surgery with Gynacare TVT tension-free support. During this time, there should be little interference with your daily activities. Your doctor will advise you to avoid heavy lifting and intercourse for 4 to 6 weeks.
I don't know whether it was the day after or a couple days after, but I sneezed and I thought, oh, I'm dry.
I was so excited about it that I could laugh and I could cough and I could sneeze without leaking.
When I would be walking and have this leakage, I just really used to get discouraged. But now I can walk. In fact, I'm walking 2 miles a day. And I can do my work around the house and have no problem today. It's just that you feel so much better on life.
This treatment should not be performed in adolescents or women who are pregnant or plan to become pregnant in the future. Additionally, women currently on anticoagulation therapy should not be treated with Gynacare TVT tension-free support. All medical procedures present risks. Rare but possible safety risks associated with Gynacare TVT tension-free support include injury to blood vessels of the pelvic side wall and abdominal wall, difficulty urinating, and bladder and bowel injury.
I would recommend it to anybody. I suffered for many years not being able to do the things that I enjoyed doing, and now I'm back to doing everything. So you really don't have to put up with that, regardless of how minor you think the inconvenience is. You realize that it was probably more major than you realized.
You should go to your doctor and see about this TVT treatment. It's wonderful. I would recommend it very highly.
Just being able to do everything that I want to do and not worry about having to find the nearest bathroom or whatever has really just changed my life.
For a complete description of risks, see the Adverse Events section of the product information at the end of this video, or visit www.controlsuddenurineloss.com.